I'm so excited today to have Melissa Marquis here to share her story. Melissa, can you let me know a little bit about yourself? Like, where do you live and what is your relationship to arthritis and autoimmune disease?
Sure, absolutely. And thank you, Cheryl, for having me on. And I'm so excited to be here and share more about my story and the book that I've written. So I live in Connecticut and I am a nurse. I've been a nurse for, 26 years now. And I've been a patient for about 17 of those years. And so I've got a bit of an interesting story. And so my journey sort of began around 2008 with what at the time I felt were very random, seemingly random symptoms that didn't make sense one way or the other. None of it connected. They were just very disparate symptoms. I had Raynaud's that developed out of nowhere in the summertime. And I had some other skin related issues, and things just kind of kept popping up after a short period of time. And so I went to the doctor pretty quickly and tried to identify what it was. And I knew that it had to be an autoimmune disease. So I went straight to a rheumatologist. I didn't even go to my PCP. And so I asked for some recommendations from colleagues at the hospital I was working at. And they basically, when I got to the doctor's office, they took tons of blood and ran all kinds of tests and said, everything looks good. You look good. So yeah, we'll just follow you and see if something pops up. And I wasn't thrilled with that answer, but I kind of knew going into it that that's what they'd say because it just didn't seem like there was much there. And fast forward 10 years, here I am still going to see a rheumatologist every 3 months. And they keep doing the same exact thing every 3 months and taking lots and lots of blood and trying to identify what's going on. Meanwhile, my symptoms have continued to progress and I'm starting to see patterns in the flares that I would experience. And so at about that 10-year mark, I changed doctors entirely. I was getting frustrated. She wasn't answering me and giving me information that I had wanted to hear. And she's just sort of dismissive. And so I saw a different doctor.
And just to clarify, so in 2008, you kind of said, I have all these random symptoms. They might be connected because that's how autoimmune stuff is. Whack-a-moles popping up all over your body.
Right.
You were still being able to visit them every 3 months? Or,
Yeah.
oh,
Yeah.
wow,
She's,
that's unusual.
she told me from my first appointment, she said, well, I can't diagnose you with anything particular because nothing's showing up, but I do think that you have some level of autoimmunity. So she said, your immune system is not quite right, but it hasn't progressed enough for us to really kind of nail it down.
Right.
So I stayed in that boat really for 10 years almost. And it wasn't until going to that second doctor, that very first visit, she said, well, you have undifferentiated connective tissue disease. And nothing else had changed, but it was just a different person hearing the collection of all the different symptoms over those years and watching to see. I had a couple of lab values that were abnormal, that were more lupus-like indicators. And so I think that's kind of what tipped them off or maybe moved the needle enough to say, yes, you do have something going on. And then around that same time, I started developing some systemic symptoms. So I was having a lot of GI issues at the time. And I probably had always had some level of GI distress, but just didn't attribute it to anything. It was always healthy, but it wasn't until those got worse that I actually started to talk about them to my doctor instead of just ignoring it. And she's like, oh yeah, we need more testing. And then that's kind of what got the ball rolling with that. And then again, about 3 years later, I finally was able to get into a Scleroderma program in Connecticut where they quickly diagnosed me there with Scleroderma. But it took that long. It probably was maybe a few months into my symptoms first beginning all the way back in 2008 that I knew what I was going to develop. I just knew. As a nurse, I'd seen it before only once, but it just was kind of an image forever embedded.
Wow.
Yeah,
And
that's my journey there.
well, and you're not the first person on the podcast that has had undifferentiated connective tissue disease, but I believe if my memory serves, which is not always perfect, but you're the first person to have scleroderma on the
Yeah.
on the podcast. So first of all, thank you for sharing your journey. I'm so sorry it took so long. I mean, so many years, and
Yes.
not just a long time, but it wasn't just like stagnant time. It was like you're
No,
actively
it was
trying.
persistence.
And sometimes the diseases do take a while to manifest fully to the clinical point, but it's still so frustrating.
Yeah,
But
yeah.
if we could take a moment just to let the audience know what is scleroderma and what does it feel like to
Mhm.
you?
So scleroderma is kind of a broad term. So there's at least 4 different types of scleroderma that you can have. There's 2 main subtypes. There's a linear, which just means that you literally have like lines on your skin. And there's a particular type that can cause, it's called un de sable. It's a French name, but it's basically like a sword mark across your forehead. And it causes fibrosis at the heart of the disease, whether and whichever type you have. And so there's an overproduction of collagen in your body. Your immune system's attacking itself. And because of that, it thinks that it's being injured. And so collagen is part of the cell structure that forms scar tissue as a healing property. And this overproduction of collagen ends up building basically layer on layer on layer of new scaffolding, in essence, within your tissues. And with the systemic versions, it does the same internally in your organs as well. And so it causes that fibrosis of the skin, so the thickness and the tightening of the skin to varying extents, depending on which type you have. And then it can cause damage to your blood vessels, the same type of thing, causing that fibrosis and stiffness, and then to all your smooth muscles. And so that it doesn't contract. So there's almost every patient with scleroderma has severe or could have severe GI disease, anywhere from your esophagus, from swallowing. Your esophagus muscles just can't contract because they're all smooth muscles. So you don't control that. But that's what aids in getting food and liquids down and propels them into your stomach. And then the rest of your GI tract has the same type of structure. And so there's a lot of motility issues in patients with that due to that smooth muscle damage. And then lastly, it can affect your nerves as well and cause damage. So you lose sensation or you have a lot of pins and needles and pain. So that at a heart is what the disease is. So you've got the linear version, and then you've got there's 2 separate types of systemic sclerosis. That's the systemic name for it. And that's what
Yes.
I have. I've got the limited type, which just means that I have limited skin involvement, but I have all the internal organ involvement.
Yeah. And scleroderma is similar to, I think it has a little bit of a PR issue in the similar to Sjogren's, which is, first of all, most people have never heard of it. But if they have heard of it, with Sjogren's, I think it's just dry mouth and dry eyes. And with scleroderma, they think it's just tightening of the skin, which is not fun and it doesn't help you function. But like you're mentioning, it's much more intense than that.
Yeah, absolutely. And it's a rare disease. Unfortunately, a lot of autoimmune diseases are on the rarer side, with the exception of lupus, MS, diabetes, some of the ones that are more mainstream that you hear about. And so unfortunately, like you said, it's just not getting that, I guess, community level recognition. And therefore it's not getting the awareness, it's not getting research funding. And so it's difficult, not just living with the disease, but, on the physician end of the healthcare end, trying to figure out how do we stop this?
Yes. Yes.
It's hard.
Yeah. And I just realized I didn't mean to truncate your diagnosis story. I'm curious now that we've explored what it kind of is, what did it feel like to you in 2021, 13 years, if I'm doing the math right, after your a first appointment with a rheumatologist? What did it feel like to finally get that diagnosis?
Validation. Like I said, I knew really almost from day one, almost before any of my doctors did. That first doctor that I saw, she looked at my fingers. My fingers have always been long, narrow, and kind of tight and shiny. But I never thought about it before because it never caused me problems. I have full mobility of my hands. I never had any significant issues. But I remember her remarking anytime I would go into her office and she'd kind of stroke my fingers almost. And I'm like, what are you looking at? And I said, are you looking at the thickness of my skin? She's like, yeah, have they always been like this? I was like, I guess, I don't know. They're my fingers. I didn't pay attention. And thinking back, I think all along that's scleroderma was on her radar. But again, with scleroderma and many other autoimmune diseases, most patients will have a positive blood type called an ANA, which is an anti-nuclear antibody. And it's just basically your body producing an antibody that is indicative of some sort of an autoimmune disease and that your body's attacking itself. And I always was negative from day one. And so for scleroderma patients, there's like maybe 95% of the population has a positive ANA. So it's super rare to not have an ANA that's positive. And so mine was negative for about 14 of those years, even before my diagnosis. And so that was really the hesitation, I think, for a lot of the docs that I saw, was that one blood test was negative.
But that's just so, I'm sorry, this is one of my soapboxes, but it's, if there is an exception to every rule, especially in autoimmune, and people, it's a misnomer with rheumatoid arthritis, which is what I have, that you have to have a positive rheumatoid factor. In fact, only 30 to 40% of patients have a positive rheumatoid factor when they're first diagnosed. Eventually, about 80% will have it. But then if you're always playing the odds, then every single 100% of the people in the rare category are never going to get help. I know I'm preaching to the choir to you.
Yeah, 100%. Yes.
It just
even when I did finally test positive, and the type that I tested positive for is not common, again, in scleroderma. And so I was so excited. I was like, yes, I'm finally positive. I sent a message to my doctor at Yale. I was like, does this mean what I think it means? Like, I was really I needed that validation. Like, I couldn't stand being in that quasi, you have something, here's this really kind of amorphous definition of undifferentiated connective tissue disease, saying, yeah, you've got a disease. We don't fully know what it is. You haven't presented enough, or it hasn't manifested enough, but yet here we are. And so I needed something more beyond that, because I knew what I had. And it was so frustrating to be in that spot for so many years. And then once I got the diagnosis, it was validation. It was relief mixed with, oh crap, now I have to live with this. And what does this actually mean for me? What is this going to do to me down the line? Obviously, it's a progressive illness, and unless a cure is found, it's not likely to get much better. I'll probably have plateaus, but that's maybe the extent of it. I don't know. I can't predict how things are going to go. But so it was a lot of just kind of identifying what emotions I was feeling at that time and working through each one of them.
100%. I honestly, if I had to choose two words to describe my feeling at diagnosis, it was also validation and relief. So I really, really relate to you. And then, mixed with a little bit of fear, but I think that's something that often I'm asked to talk. I love talking publicly about my patient story and everything, but I think often I admit I'm a little hard to interview sometimes, as I feel like the reporters are often wanting there to be this very linear journey of, I felt really sad, and no, I'm happy and I'm thriving with arthritis. I'm like, it's not that simple. It's not that simple.
No, I was talking to somebody about this the other day, and I said it's very much like a child's drawing, where like a 3-year-old drawing something, and it's all these squiggly lines in all these different directions. I said, that's my journey.
I love, well, and you talked about you couldn't stand being in that kind of amorphous, vague diagnosis. I call that diagnostic purgatory, where you're like, this could be this. Okay. It was okay. We are partially validated because they know it's something, but you can't grasp on to any, especially from an academic standpoint or clinical standpoint as a nurse, that you want to fit the right treatment to the right diagnosis.
Yes.
And so how do you, it's like throwing darts at a really, really big dartboard versus when you get your diagnosis, you have a smaller dartboard.
Yeah. And my experience, while I was still, trying to get the workup portion to get the diagnosis for scleroderma, holding that undifferentiated diagnosis, well, that alone was validating for me after 10 years of searching for something, anything. I got that. But then my doctor that had actually diagnosed me with that she moved. And so I had to see somebody else coming on into her practice. And he didn't agree that that's what I had. He's, you don't have this. That's not a real diagnosis. Blah, blah. Like, he's just going, I was like, you're a rheumatologist. What are you talking about? I'm like, it is. Here's the research. And even now, my doctor doesn't want to let go of that diagnosis. She's even though you've fully presented and transitioned into scleroderma, you still have symptoms of other autoimmune disease. And none of them can we fully identify those yet either. And so I know I'm going to, start collecting autoimmune diseases. It's common with us, unfortunately. But I told her, I was like, I hate the term because undifferentiated is so vague and it just doesn't mean anything. And people just dismiss it entirely. And she's like, well, who does? I was like, doctors? She's like, really? You've experienced that? I was like, oh my God, too many to count. Yes.
Yeah. It's like fibromyalgia. Certain diagnoses just have a bad reputation. For me, for a while, I didn't want my doctors to put anxiety disorder on my chart, either for similar kind of stigma-related reasons. Not that they would think that because I had an anxiety disorder, it meant that I didn't have RA. Like, I think most people could see both of those on a chart and be like, yes, those are both valid, but I didn't want them to, like, in my mind, this is not true now at 43, how I understand my brain and that I do understand that I have generalized anxiety, but back then it felt like I was not anxious until I started getting sick anyway. But I understand that feeling deeply of not wanting that stigma and needing the validation. I really want to stop myself talking, get to your book because it's fantastic. But first, I want to quickly give you a chance. Are there any treatments for scleroderma?
Yeah, there definitely are. Like with most autoimmune disease, kind of the mainstay of treatment is some sort of an immunosuppressant or a disease-modifying agent to suppress or reduce your immune system from being in hyperdrive. And so currently taking 2 of those medications. So I've been on Plaquenil, which is hydroxychloroquine. It's a common lupus medication that they can use, and they use it for other autoimmune disease as well. So I've been on that actually since 2008. So that was one good thing about my doctor, even though early on I didn't have a diagnosis. And it's not that she dismissed me entirely, but she at least had the foresight to actually try to slow things down. And I think maybe if she hadn't done that, I probably would have more quickly developed those additional symptoms. Instead of taking 10 years, maybe it would have taken 5. So I don't know. But so anyhow, I'm on that. And I also take methotrexate. That's the newest addition because I now have new scleroderma cardiac disease. So my heart is very swollen and inflamed right now. So we're trying to calm that down pretty quickly to reduce some of the symptoms I'm having. And then I'm not sure if that's going to be a treatment I stay on long term, or if I tolerate it and I respond well to it, hopefully I can come off of it and then maybe only use it as needed. Think forward. And then the other medications that they typically use is we all have developed Raynaud's disease or phenomenon, which is a circulatory issue affecting primarily your hands and your feet. To cold and to stress, your fingers generally will turn white and blue and very cold, have no blood flow. And so it's really important to maintain that blood flow. So they put us on vasodilators to open up those blood vessels again. And there's varying medications that they can use based on the severity of that. And then from a GI perspective, since a lot of patients have GI disease, they'll put you on a PPI, a proton pump inhibitor, or like a Prilosec or, any of those types of over-the-counter or prescription.
Yeah.
Yeah, I can't take them because they can cause, in many patients, especially with scleroderma due to our motility issues, it can cause something called SIBO, which is small intestinal bacterial overgrowth.
I've had that. Sorry, it's your story, but it is not fun. And by the way, just know if you're experiencing really, really extreme bloating, and I wish I had known what that was and to ask to be evaluated for it earlier when that happened to me.
Yeah, and I reduced for years.
Oh, I'm so, yeah. I just thought this. Well, and I always thought it's so hard when a hammer everything's a nail. If you have gastroparesis, like, oh, it's just your gastroparesis. So then you're like, okay, but it could be 2 things.
Exactly. So yeah, in terms of meds, I can't tolerate any of the normal GI meds to help with the reflux issues that we all have. And so I usually will take I take a lot of different herbal treatments or supplements to help from a more naturopathic standpoint to help with some of those GI complaints. And then I rotate. I have to stay on cyclic antibiotics for my SIBO because it's a recurrent progressive thing. And so it's never going to go away for me. And so I alternate between antibiotics and herbal antimicrobials every month, depending, just so that I don't kind of build up that resistance and just to give my body a break from different things. So yeah,
That's a lot. That is a lot.
it's a lot.
As I said those words, I remember the first time a therapist ever said that to me. And I just remember that validation I felt like, because I was like, wait, I know it's a lot, but an outside person saying it's a lot, who also like job is to listen to people talking about tough things in life.
I know it.
Yeah.
That's funny when I do these and I start talking about all the things that I've gone through and all the different tests and medications and stuff. When I think about it on my own, I can compartmentalize it all. There's, oh, I'm just dealing with this today.
Me too.
But when you like start talking about it, it's, oh, wow, that sucks.
Yeah. It's so strange I joke with kind of like understanding and processing your own experience, kind of like standing 2 feet away from like a Monet painting. It's like to you, it's kind of you're just like stroke by stroke, or maybe looks like a little bit of a mess,
Right.
but
Yeah.
when they're 20 feet away, they're like, it's a lily pads. And you're like, what? Oh, I didn't realize. So
Yeah.
before we talk about your book, one last question. What is if you don't mind, I didn't prepare you for this question, but this hopefully is straightforward. What is your nursing background in terms of what area did you work in or work in?
It was primarily pulmonary medicine. And so I worked in a adult pulmonary medical and step down unit.
That's lungs, by the way, to people.
Lungs.
Yeah.
Yeah.
I was trying to like define everything because we just don't know.
You just don't know. Yeah, exactly. Yeah. So I worked there for 11 years, a few years while I was in nursing school. And then I stayed on the same unit as a nurse. And then I transitioned and started working with kids in outpatient doing research and endocrine testing. So I learned a lot throughout my career, but my passion was always working with cystic fibrosis patients. We were the only adult CF unit at the hospital. And so I very quickly became super attached to them. I was close in age. I was a little bit older than them. And I was so protective of them. And at the time, this is going 20 years ago now, but at the time, their life expectancy was only in their low 30s. And so it was a lot of working with them on end of life issues and just kind of navigating that with them. And for whatever reason, I don't know, I think just God gifted me with that ability to connect so personally with it, even though I had no experience with that yet. And now I still maintain contact with a few of the patients that are still alive at this point. And just watching how they handled a chronic progressive disease that is fatal and scleroderma can be, I think that was the best thing to prepare me for living well with my disease, because I saw them at their worst day in and day out. They were hospitalized for months at a time sometimes, and just their tenacity and will to live and desire to live and fight, it was so inspiring. I can't put it enough into well-articulated words to really indicate like how much that meant to me and how much that formed who I am right now, living with my own illness like that. So, yeah.
Well, yeah, that's extremely inspirational, and hopefully in a way it's karma in the sense that you gave so much to support those children, and now you're getting back you're getting a benefit to that, to yourself, in terms of having learned maybe the coping skills and stuff like that. Yeah. Well, and speaking of paying it forward and such, you've written a book that I love the title, Invisible, a nurse turned patient's resource to living well with autoimmune disease.
Mm-hmm.
What inspired you to write this? And before I started hitting record, we already talked a little bit about it, but I would love to hear a little bit of the process of your kind of inspiration, if that makes sense.
My inspiration was frustration.
I love that. Inspiration via frustration, from the frustration to inspiration plot line.
It really was. I mean, because my journey took so long, and the fact that I'm a nurse, I know how to navigate the healthcare industry. I knew what questions to ask. I knew which doctors to go to. I didn't delay seeking care. Like, I did everything right. And it still took me 10 freaking years to get a diagnosis. And that wasn't even, I say, the real one, but the one that is more significant for me. And so I got to thinking after I finally received the scleroderma diagnosis. I mentioned that I felt validated and relief and almost like I can take off that added weight, like the bricks and the weight of the world was on my shoulders. And I felt at that point I could just take it off, shut it all off, and just breathe for a minute. And I thought, okay, well, now that I have a minute to breathe, how can I help other people? It's my innate wanting to help. And so I thought, well, I really, for so long, all I wanted was a resource or resources that I could go to where I could type in, I have this symptom, and this symptom. What does it mean? And I couldn't do that with Raynaud's, with fatigue, and with skin issues. Like it just, oh, and joint pain. You type those in and you get millions of hits that don't tell you anything because those are such common symptoms that overlap with any disease, almost, with the exception of Raynaud's. But everything else can be attributed to the common cold, to cancer, to autoimmune disease, to a hangnail. There's just so many things that it could be leading towards. And so I wanted a resource for patients that are going through that same process that I went through, where they can say, okay, maybe there's something that can help me connect the dots, because that's really what I needed. I needed to find a way to connect all the dots because I knew they were connected, but I just couldn't get enough data behind me to say yes and show it to my doctors and say, see, I told you. And so that's what I wanted. I wanted a resource that was both educational in nature, but not heavily, not overly. I didn't want it to be disease specific to my own because it's such a niche audience. I knew it wouldn't gain traction and I wanted to be able to help the most amount of people with it. And all of the things that I've learned and amassed over the years really can be translated across any illness, honestly. I mean, it's the tools are all the same. It's just the disease and the education, the information that might be different.
Yeah.
I wanted that to come out as well within the book. And the secondary piece was that I wanted to share parts of my story to show that it's okay to be vulnerable and it's okay to be open and really just showcasing what it's like to live with this type of a disease, because we hear all the time, well, you look fine. You look great. Or why? Yesterday you went for a bike ride and today now you can't go to work. What's that all about? There's just, people don't understand how to respond to somebody that looks normal on the outside, but they're not. And you see it with a lot with mental health issues, and just trying to break that stigma and trying to reinforce to people, look, we're all going through something. It might not be medical. It might be something in your personal life, your work life, whatever it is. We all have something hard that we're dealing with at any given day. So just be nice. Don't just think before you speak, and just, I don't know.
I need to hear that. No, and to blurt things out. But
well, yeah,
no,
I mean, we've all been there. We've all said stupid things, but just again, that kind of friendly, gentle reminder, you can't judge a book by its cover, hence the title of the book, Invisible. So I wanted people to feel, particularly patients or individuals living with diseases like this, I wanted them to feel that validation. I see you. I understand what you're going through. Might not be the same disease. I might not feel exactly what you're feeling, but I feel you. I get it. I understand. I live it myself every day. And so I just wanted it to be kind of an encouragement for them and to empower them to share their story, to share their information and be maybe a little bit more open and vulnerable with expressing what's going on in their life, so that hopefully they can combat some of that dismissiveness that we all feel. So
that's so needed. That's such a needed resource. And yeah, I can't tell you, like, having run support groups for people with, the autoimmune types of arthritis, rheumatoid arthritis, psoriatic, and ankylosing spondylitis, it's like it's something that everyone has in common is having to, well, unless some people do have very visible, quote unquote, deformities or hand limb
Yeah.
differences if they have pretty progressed disease. But even so, someone might not even notice that. They might not be looking at your knuckles in the case of RA, maybe your posture. In the case of ankylosing spondylitis with like bamboo spine, there are visible symptoms, but often people are just looking at faces. They'll look at your face and
Right.
be like, you look beautiful. And it's just people don't know what to say. And so they'll try.
Yeah.
Yeah.
And I think a lot of it really is that they're grasping for something to say. And so your default is to compliment or to say something nice, which seems nice. Say, oh, I get it all the time. You have such a beautiful smile. You
Yeah.
look so good today. And I smile, I say thank you, and I just kind of go along with it. But really, it does nothing for me. I know it's well intentioned and it's meant to make me feel good, but I think just because I hear it so much, it's lost that positive feeling for me, and it just kind of makes me feel more. I don't know what to say. I
Yeah.
don't know.
It's
So
invalidating. I
yeah,
feel,
I think
yeah.
especially in days where I really feel like crap, and
Yeah.
it's a struggle, and I think we tend to we have to carry on. Like if if we let our exterior body and facial expressions control what we actually feel like on an outside, like we'd never leave the house. We'd never do our hair. We'd just be like zombies. And that's not helpful. That doesn't do anything. And so I don't know. We get to a point where you fake it till you make it sort of process and you just keep going forward.
Yeah. Sometimes I've heard people think of creative responses to, yeah, I wish I felt as good as I look. Or unfortunately, or I'd believe me, I'd trade having a beautiful smile for feeling better on the inside. But you don't always want to turn it into a teachable moment. It depends, especially if you don't want to invalidate. They're trying to make you feel better. And then you're like, okay.
Yeah, you don't want to make it awkward. Just say thank you and move on.
Yeah. Well, and so I really just think it's great that you provided what's in the book. It's not only a tips for living well, which is in the title, living resource for living well with
Right.
autoimmune disease in terms of here's our ways to manage it, but also that ways of understanding and relating to your own self and your social environment having an
Yeah.
invisible condition. And I'm just curious because the book came out in 2024, right?
Well, yes. So last August.
What have been some of the responses so far? Like I looked at the
Um,
Amazon reviews and they're very glowing. Like,
yeah, no, yeah, overwhelmingly positive. Almost everybody that's either reached out to me personally or through social media or what have you, I've heard, oh my gosh, it's so validating. It's like you were talking directly to me or
yes,
about me. I get that so often. And so I knew if when I decided to go through this and writing a book is expensive and you have to pay it yourself. Like there's really kind of not much going around that. At
mhm,
some point you are paying for the book. And so I thought, well, all right, if I'm going to do this, it for me to be able to touch one person and be able to give that give them that sense of validation, that sense of empowerment and encouragement to keep fighting and keep moving forward and pay it forward, then it was all worth it. $5,000, sure, okay. Whatever the total cost ended up being. But I wanted to be able to have that minimal of an impact. That alone would have been enough for me to do it, just to hear from one. And so obviously I've heard from many more than that. And they've been resoundingly positive, which is I'm so grateful for. But it also makes me a little sad though, because that means that there's a lot of people out there that feel the way that I do, but yet we're not talking about it.
yeah. Yeah, I mean, it for me as somebody who's like, quote, the kids say these days, chronically online, somebody who's online a lot, I feel like that's what social media has formed or has allowed is a medium for patients with invisible conditions to feel validated. But
Yeah.
there's kind of a flip side of that where sometimes can become either an echo chamber of maybe misinformation or like kind of worst case scenario is repeated over and over and gives people a false sense of the prognosis of the condition. I think that is particularly true in a condition like rheumatoid
Sure.
arthritis, where there are effective treatments that are putting the majority of people in remission, but then
Mhm.
on the groups, the majority of people aren't in remission, and that doesn't mean that they shouldn't have a space to be together, but there's always issues. So I think having your perspective as both a health provider, as a nurse, kind of having that validation and a perspective of, I know you have a doctor that, or Scleroderma
Yeah.
Foundation member that contributes as well, gives it that kind of validation.
Yeah, definitely. And I wanted to also include not only just my personal and professional experiences, but I wanted to make sure that because I was not focusing on just one particular disease for the book, that it was a broad brush, that I wanted to incorporate other individuals living with different types of autoimmune disease. And so I interviewed, I think it was 4 or 5 patients that have different autoimmune diseases, lupus, scleroderma. Did I have an MS in there? I'm trying to recall now. I had a couple of different diseases that were outlined. And so I asked them all the same 5 questions and just trying to get their sort of insights, their recommendations, things that they would tell a new patient or
Yeah.
a newly diagnosed individual with X disease. What is it? What are the things? What are the things that you wish you knew type of approach? And so I incorporated those stories in there again to just add to that. And then I also interviewed my doctor at
Yes.
Yale and wanted to get her take from a physician standpoint, particularly when seeing patients in a first visit or maybe a follow up visit, and trying to make sure that individuals that are being worked up for a diagnosis, when you're going to see a specialist or a subspecialist, in my case here, that you're bringing the right information to that appointment. Like you're doing your due diligence as a patient to make sure that you're getting the most out of that appointment time. Because we all know that the medical system's broken, that
Mm.
our appointment times are way too short, and there's not enough time to get all of the information, all your questions answered. So really wanting to help people to navigate that end of healthcare system. So giving, again, my personal recommendations, what I've used as a nurse, my doctor's opinions, different things, bits of information that can hopefully help somebody else navigate their own journey with that.
And that's so true. I think we not everyone even understands how broken the healthcare system is, especially if you've been had the kind of what I call health privilege of being able-bodied and not having health issues for a long time. Sometimes people are shocked at the level of care that they receive, and if you have no other explanation, at least for me, I assumed that I was doing something wrong when I was having such a hard time getting an accurate diagnosis. I assumed I must have not explained myself well, or I must have, maybe they think I'm not worthy, and that's why my appointment's so short. People tend to blame themselves and not
Yeah.
understand that there are these systemic issues at play. So I think even just your story, I'm thinking just sorry, back to the topic of advocacy, of just even making it explicit that, hey, you have to advocate for yourself. It's not like you did something wrong and that's why you have to advocate. It's like the system is
Yeah.
not set up to help you unless you advocate for yourself.
No, and even when you do, so I'll just share a quick story. So before I went to Yale, I went up to Boston to another scleroderma program that I was recommended to go to. And so I got an appointment rather quickly, which I was happy about. So I brought all of what I felt were my relevant medical records over, sort of, again, spanning 11 years of information at that point. And so I condensed it, consolidated, and got the more relevant pieces and put it together, and I sent it to them. And then I also brought a copy with me. And so at the appointment, my doctor tells me, well, you're so detail oriented and organized in how you're laying out your illness and how you felt over the years. You're so detailed, in fact, that you're leading me to the path of diagnosis that you want. And I was flabbergasted. Yeah, I was dumbfounded. I couldn't tell, was he trying to be complimentary or was this an offhanded
Like
slap?
that you are doing his job.
Yes, that's what it was.
If you are going to do it, I will do it.
Yes, exactly. So that was how I came across, or how I felt he was coming across, that I'm trying to make the diagnosis. And unfortunately, for I think healthcare providers who are also patients see this more often than regular people that are not in the medical field, because we tend to know a little bit more. And nurses, I think, particularly get a bad rap out of diagnosing themselves and going to the doctor and saying, this is what's wrong with me, just write me the prescription. And I think that that's what he felt. But either way, it doesn't matter. You don't ever tell a patient, you're leading me to the path of diagnosis that you want. I never, ever would want somebody to have to deal with the crap that I deal with. And nor, not even just me, but any autoimmune disease in any patient. That's how dare somebody in a medical profession say that? The disease.
It's the same. It's happening now. And this is important to talk about, even though it wasn't what we planned on talking about. It's happening because of social media, patients with more rare conditions, or patients that have historically been underdiagnosed in certain populations, for example, different cultural, ethnic groups, or different genders. So the common one, I used to work in pediatrics, the common one was ADHD and autism are often missed in young girls and young women because they can manifest differently and people compensate in different ways. And now some doctors are saying, well, these female patients are coming to me and they think because they saw some video on TikTok that they have ADHD. And it's like that. I'm like, are you so sure that the norm references that you have in the DSM or whatnot are from, if you've been missing this population the whole time, it's possible there's one or two truths can be true, right? There's that it's being underdiagnosed and now awareness has led to it being correctly diagnosed. And it's increasing in quote unquote incidence and prevalence just because the numbers are rising because people are more aware of it. Or is it what you think it is, which is what your bias is telling you, which is that you think that actually it's now overdiagnosed in women and girls. But it's like they jump sometimes to the conclusion that's the least flattering to the patient and that makes their life easier, which is hard for us.
It is. Yeah, absolutely.
It's happening with hypermobility in EDS too. So
I'm pretty sure that I have a variant of EDS, and we're kind of in this weird, do you have it? Do you not have it? There's no test available for it because I've tested negative for every available test. But yet I've got presenting symptoms that make it seem likely. And so, it's difficult when you're in that boat or in that predicament where it's like, how many times can I go to the doctor and tell them the same exact thing and expect a different result? It's maddening.
Well, I feel you so hard on that. I don't think I've ever been truly hopeless more than 2 times in my life. Both times they were around health issues. And one of them was where a similar situation to you, where I had basically, because no one else was doing this, I had kept a symptom tracker and and I didn't have this clinical skills. I was a junior in college, right? Studying psychology at a liberal arts college. I had no health experience, but I was just like, okay, well, I'm the one who lives in this body 24/7. There's clearly something wrong. So I checked things and my parents had actually hired, I had every privilege in the world. Those of you listening to the podcast before have heard this story, but you can hear more about it on episode 100, which is the one where I interviewed my parents. But they had hired a concierge doctor because we had the resources too. And they were like, we trust our daughter. We know this is not normal for someone to go from 135 pounds to 105 pounds, wasting away. All we know is, okay, she finally was accused of hiding an eating disorder, which I'm saying the word accused because they were saying, you're lying to us. They accused me of lying and hiding an eating disorder when I was like, no, I want to eat. My stomach's not digesting. And they're like, oh, actually you have gastroparesis. Okay. Well, that's a thing, but we still don't know what's wrong with you. And before my RA diagnosis. And so I started tracking things. Sorry, it's too much of my story, but I took it to the doctor and I'm 20 years old. Right. And I'm like, I was a captain of my soccer team. I was so functional, a year and a half ago. And then my body started wasting away. So I'm like, let's figure this out. And what do you think? She literally lifted up the symptom tracking thing. It was like, what do you think it means that you did this? And I was like, it means that I'm trying to I'm suffering and I'm trying to figure out why. Now, this is my recreated memory of I wish I had the exact transcript. This is how I remember it happening. I could
Sure.
track her down and find it. But she is the doctor that eventually diagnosed me with RA. But she at this point in time, she said, it means that you've become hyper fixated on your health. And you're right now, basically you need to chill out and go to a psychologist or psychiatrist and stop worrying so much. I'm like, I wasn't worried until I started, like the chicken or the egg.
Right.
The thing is, my body started malfunctioning, and I joke, it's like your house is on fire, which is my body, and you call the firemen, and they're like, we diagnosed you with lady who thinks her house is on fire.
Yep. Exactly.
You're like, what do you do? Who do you talk to?
I know it's so incredibly frustrating, maddening, all of that. And the best advice I can give somebody is just don't give up. Just keep going. I know it's so defeating, exhausting, all of it. Like it's awful to be in that position where no one believes you and you're questioning whether or not, at least this in my case, it got to the point where, either doctors or other people were being so dismissive of my symptoms and suggesting that it was me causing myself to be sick because I'm now perseverating on all of the things that are wrong with me and I can't stop it. I cannot get my brain to turn off or to turn from just focusing on what symptom at the time. Like for a long time, it was my gut and how bad I was feeling. And that's all I thought about was how bad my stomach felt. What could I eat that was safe? And what happens if my safe food turns into bad food? And I would get sick after that. And so I'm like, I'm making myself sick. And you start to almost believe what other people are telling you. And I'm so glad, even though I experienced some periods of that where I did doubt and I did question, am I doing this to myself? Am I really making myself sick? Is there really nothing wrong with me? It finally, for me, the turning point out of that was to finally get some test results that said, yes, there's indicative disease here. There's measurable disease that we can see on these tests now. And up until that point, it was my word only and how I felt. And so I just want patients, or I got to get away from saying patients all the time, but I want individuals to feel empowered so that they keep going, because it is so easy to just throw your hands up and say, that's it, I give up. I don't want to do this anymore. And I don't want to take the medications. I don't want to go to the doctor. I don't want to do anything. I'm not going to talk about it. I'm just going to live. And while that might be okay for a short period of time, just to give you some mental health reprieve, in the long term, you're not helping yourself physically. You're not addressing anything that's going on. And so you still have to have that drive to keep moving forward. But it's hard. Yeah. Oh my God, it is so hard.
And trusting yourself, trusting your knowledge of your body. You're the only one that knows what it is like to live with your body. And I really do believe that people have, it's called interoception, which is like one of the three hidden senses, right? Vestibular, proprioception, and interoception, which is your awareness of your internal bodily states, whether that's pain or temperature, like kind of tummy, all that stuff. That it's, what your body feels like. And so I think you're so right to say, don't give up if you believe something's wrong. And is there, in that kind of, I don't know if that's would be the same question or answer, but to move on to the rapid fire questions, my first question was going to be, what are your best words of wisdom for people who are newly diagnosed with something like scleroderma or, mixed connective tissue?
I think really what it comes down to is you have to learn how to be the best self-advocate you can be, because that's going to encompass the rest of your journey as a person living with a chronic disease. You've got to learn how to stand up for yourself, to ask the hard questions. And doctors, I think in general, and maybe this is a bad misconception on my part or a judgment, it's not intended to be, but I feel like they They don't want to be questioned. They don't want to have to explain, maybe for the 18th time, what's going on with your body. And at the end of the day, it's your body and you have to live with it. And so just keep being persistent. If you don't understand it, if you feel like either your illness, your tests, or the things that they want to prescribe for you, if they're not explaining it in a way that you can understand, you need to keep telling them, I don't understand. Tell me in a different way. Talk to me like I'm 5, or talk to me like I'm 95. Whatever your most comfortable way to learn is, you need to understand it, because if you don't understand it, you're not going to be compliant with whatever treatment. You're going to get frustrated. You're going to fight the system. You're going to fight your body, and it's going to ultimately make you sicker. And you're going to be more unhappy. It's going to affect your mental health. There's just so many things that are going to play into this and impact or interfere with how you're going to progress moving forward. And so I think that self-advocacy piece is the biggest aspect to this. And there's a lot of people that I feel, especially more in the older population, where they implicitly trust their doctors, which is great, because doctors do deserve respect, and they've gone to school for a very long time, and they've studied for a very long time to really become an expert in their fields. But to blanketly trust that they have your best interests at heart might not be the best thing for you. So it's okay to ask the questions, or it's okay to seek a second or third or eighth opinion. And you can talk to them about it. It's okay. They're not going to get upset if you want to go see another doctor.
It's the sign of a good provider.
Yes.
My doctor agrees with this. If she says that, if they're okay with a second opinion, especially there's often, at least at the rheumatology conferences I go to, I've heard this numerous times, that rheumatology is an art and a science. We just don't have all the answers. Yeah. And so, yeah, I mean, I really resonate with you saying that learn to be your best advocate, and not only maybe just don't blindly trust your providers, because I used to work in very randomly, but I worked in HR at a health academic medical center in Seattle. And I did new employee orientations, which was actually really fun. And they had this one talk it was like about risk management, but they showed this video called "To Err is Human," and like humans make errors. And the idea was not to say everyone who makes an error is like the worst person in the world. And of course, there are evil people out there who like on purpose hurt people. But the majority of medical errors are truly, first of all, they're systemic. There's usually the Swiss cheese model where numerous little things add up. But my own rheumatologist told me last week, just along these same lines, she said, I don't know what it is, if it's that the healthcare workforce has been reduced because of people leaving medicine during COVID and just becoming burned out. She said, I've had so many, she said, just in the last year, she said, I've seen an increase in incidence of patients they have not been told very clear things that are in their chart. I'll review it. I see a new patient, and she'll be like, well, it's probably because of your thyroid cancer or something. They're like, what? No one told me I had that. And there's a girl in my support group where she was having pain in her leg and her hip and her pelvis. And then she did an x-ray, never heard anything back. She has a broken pelvis. She didn't find that out until she went through her own records and realized, wait, no one had called her to follow up on this. So it's like knowing that you have to double check things sometimes.
Yeah, you have to be an informed patient. That's part of being a good self-advocate. You have to know your disease in and out, almost as good as the doctor. You've got to do the research, but you have to do it in a way using trusted resources and accurate information, not Google, not Wikipedia, not Health News Today or some random online journal, and not through blogs, even though there can be some good information shared, but that's not medically sound information. And so that is probably my second tip for patients is to be an informed patient. You have to know all of it. You need to at least know what the common tests are, what the common treatments are, and because otherwise you're not going to know what questions to ask, and you're not going to know how far you want to go with treatment.
Yeah, 100%. Do you have a favorite quote or inspirational saying for tough days?
Yeah, actually, I'm stealing it from my doctor. So I had because she participated in the book, I'd sent her a thank you gift for her help. And so she had sent me a card in the mail a short time later. And she said, she closed it out saying, "You are not invisible, you are powerful." And that literally almost just broke me in a good way. Like, I've never had really anybody tell me that, let alone my doctor tell me that. I just felt so seen then and empowered at that point. And I just thought, oh my God, that's the tagline for my book. And so that's it. That's what I think of now when I'm having these really difficult days and when I'm continuing to struggle getting new diagnoses or dealing with new symptoms that keep popping up. But yet I still remain that very rare zebra among autoimmune disease where you think hoofbeats and most people would think of horses. No, you got to think of a zebra or some other very rare animal when it comes to me. And so constantly telling my doctors, look, I don't fit the medical textbooks. You can't think like a doctor right now. You've got to think like an investigator, and a detective, and think outside of the box with me. So that she's helped me with that. And so I use that when I'm signing my books. I don't use her exact words. I say, you are not invisible, be empowered. So it kind of took a little spin on it and making it a little bit more action oriented for the individual to take ownership of it, because you have to, if you want to live a good life with this, you have to be an active patient.
Yeah.
So
100%. Oh my gosh. The next rapid fire question is, do you have, and it's okay if you don't, but a favorite arthritis gadget or tool in your toolbox?
I don't have a favorite. I do use a couple of different things. I think the one that I use the most is like the jar opener, the long thing with the different sizes. That's most helpful for me. But because I don't have a lot of true physical difficulties, my biggest challenge is my fatigue level and just my stamina. I don't have the endurance that I used to have. And so like I'm a runner, I'm like a cyclist. And so I love being active and staying as active as I can because it's helping me stay healthier longer. But I get frustrated with myself because I can't do what I used to do. I can't go for a 20-mile bike ride. I can hardly hit 10 miles now. And like those are the things that frustrate me the most. And so I'm constantly playing with things and trying to modify what I'm doing to find kind of the sweet spot where I'm still getting the exercise, but I'm getting the joy out of it because I need that. So it's not a real tangible item, but
No, but yeah, fatigue is like one of the most important for me quality of life correlators. But yeah, I feel like I can work around the kind of pain that I have from my RA. I can't speak to other people, of course, but my RA pain, it's a distraction, but it's not as debilitating as the fatigue on my quality of life typically. Again, I think I've got pretty well controlled disease because of the medicines I'm taking have been working well in my body. But the fatigue, when you can't participate at all because you don't have the energy, it's just, it's brutal when you're somebody who, I joke, I started my blog in 2010 and I named it theenthusiasticlife.com. And there was a point, kind of such a point in my life where I ever felt hopeless. That was when I had the undiagnosed SIBO and I was starting to lose weight again and not know what was going on. And I was like, I don't even relate to the concept of enthusiasm. And that's like my most core enthusiasm and extroversion are like my two core personality traits. Well, extroversion / like wanting kindness, like wanting to feel a good friend and wanting to love others and help others, like you being a helper. And then just having that enthusiasm like robbed from you, even though you like your brain wants it, but your body just can't do it.
Right.
Oh,
it is definitely hard. So constantly trying to find what works and it always changes. And so like, what works one day doesn't work the next day. So just like layering different things and strategies and just trial and error. That's what it's all about, unfortunately.
But even just being able to name that and is helpful to people who are like, afraid. I have to framing it as it's going to be trial and error is comforting, because otherwise, if you think that everyone just figures it out and it's just a static thing, then you're going to be disappointed. Do you have a favorite book or movie or show you've watched recently or read?
I've been like a voracious reader lately, and so I'm reading so many books that I can't remember the names.
Yeah. Do you read on the
But
Kindle?
yes,
Me
I
too. It's so hard
I'm
to remember the
obsessed
name.
with it. I know. So I'm obsessed with it. And so for the last 2 or 3 years, that's all I do is I read. So I'm reading like 2 or 3 books every couple of weeks. And so I'm like really into the psychological thriller mystery stage right now. So for a while I was looking at rom-com type of things just to like de-stress and kind of get my head like windless reading. So I like that for a while, but now I want something a little bit more intriguing and thoughtful. That's what I'm into.
Nice. That's fun. Yeah. No, I'm in a huge rom-com phase right now. So it's been lasting a couple of years. So it's been
Yeah.
fun. Yeah. I want to do, oh,
Great.
that reminds me, I want to do an episode where, like chronic illness representation in rom-coms because it's so many more. In the last 5 years, there's a lot
Yeah.
more. I just read one called Get a Life, Chloe Brown, which is so good. The protagonist has
Ah,
chronic pain and
yeah, I have to look at that.
yeah,
That's fun.
I feel like I never grew up. I never saw any representation. Well, I got diagnosed till I was 21, but
Yeah.
I never saw as a young adult any representation of the character in a movie or a show or a book that had rheumatoid arthritis.
Right. Yeah.
So
No,
it's,
definitely.
yeah, there's a good handful. So anyway, yeah, that's another
I'll,
topic.
I'll add, I'll add to the TV conversation though. If you have not seen the show Pit on Max yet, it
My
is
poor husband, I tried to
amazing.
watch it. We are such, I can't like,
Yeah.
well,
Naughty.
I think I can.
Um,
I need to do it not before bed.
Yes. Yeah.
Yeah.
It's intense. It's really intense, but it is the best, most accurately portrayed medical drama that I've ever seen. And I was a huge ER fan for the 20 years that it was out. And I loved Noah Wiley back then. And so having him play a new physician character, like it's just great. And I love that they're incorporating a lot of mental health issues into it right now because obviously post COVID, mental health's really gotten a bit of a spotlight and we need to keep talking about it. And especially in how the medical profession was impacted by COVID specifically. And
Yeah.
that's not being talked about enough. And so I love that they're doing this. And so like, I can't wait until the next season comes out. So
Well, thank you for inspiring me to read. I think I've had to watch on my own. My husband is very, very tough in many, many ways, but the blood and guts is not one of them.
not his thing. And there's a lot of it. So yeah.
Yeah. I got a little sensitized to that through OT school, but I definitely kind of self-selected into outpatient peds. So it's not as medically complex.
Right.
And then
Right,
arthritis,
exactly.
not as medically
Yeah.
complex. But last question, this is kind of the central thesis question of this podcast, which I think your whole episode has answered in many ways, but I still like to take a moment to reflect on it. What does it mean to you to live a good life and thrive with autoimmune disease?
Yeah. So actually, when I was reading that, I was really kind of trying to think through what that means for me. And I think at the end of the day, no matter what I face, health, personal life in general, I want to always find my purpose in that. I'm a firm believer that things happen for a reason, that God has kind of ordained things to happen, and that we're there to learn something through it and to share what we learned, to be able to help other people through something similar. And so for me, this book has been my purpose and throughout the pain. So finding your purpose in your pain is probably my biggest takeaway from that question, and finding the joy in it, because I think wherever your purpose is in life, there will always be an element of joy and hard work. You're going to have both in this book, and then a lot of the advocacy work and education work that I'm doing alongside of it with volunteering in different foundations and committee work and stuff. That has driven me even further and really kind of ignited a new passion. I think I always had it. When I was talking about the CF population that I took care of, I had it then. And I always just thought it was just for that population group. And I don't think that that's the case anymore. I think it's helping those who are marginalized in some manner, to help give them tools that they can use to make their life better. I think that's really kind of what it comes down to for me, is where my purpose is in this. So as hard as it is living with this, that's what gives me hope to keep going on. One of the things anyway, to keep pressing forward, because
That's wonderful.
otherwise you just get stuck and you get lost in your negative spiral of thoughts and how bad you feel and how terrible life is. And I can't do this anymore. And I can't go out. I can't eat out. And my social life stinks. And you just go down this terrible rabbit hole and you can't get yourself out. So finding things to get yourself out, whether it's the show, I can't remember. I think she was a Japanese woman who loved to clean in order.
Yeah, Marie Kondo.
Yes. So her thing was sparking joy. That's it. You just need to find whatever it is that sparks that joy in you to keep.
I love that.
Keep your life happy and enjoy it.
And I think sometimes I do have a lot of people on the podcast who have found their purpose in helping others in the autoimmune community or the chronic illness community. And like you said earlier, it doesn't even have to be. It doesn't have to be that. It can be, you could find that you're really passionate about geology and restoring environment, or finding something that brings your life purpose and meaning and it for me, it's like, they say, like, happiness, you can't become happy by trying to be happy. Happiness is like a byproduct or side effect of engaging in meaningful, valuable, enjoyable things. So for me, swing dancing was a big kind of, and it has become a big community and purposeful activity for me too. So finding something, reminders of something you could still do. Now, not everyone can dance. I'm fortunate that my body is allowing me to dance, but if I couldn't dance, I could DJ or still be part of the community in that way.
Right. You adapt. And as my disease and as everybody else's illnesses progress, you learn to find new things and new ways to do the activities that you love. Like I said, I can't run or bike the distance that I used to, but I can still do it. I'm going to do it. When I like to go where there's water. So I'll go find a lake and I'll ride around the lake. And hey, I'm really happy because I'm being outside. I'm seeing the water. Like, that's therapeutic for me. I'm getting exercise. That's good for my lungs and my heart, like all of it. So it's that cumulative effect of just getting out and doing the next thing, I guess, is kind of a good way to put it.
Like they say in Frozen 2, the next best thing. And I don't know if you've ever seen that movie, but I'm a big.
I have. Yeah, absolutely.
It's a classic to me. I never got out of the Disney movie phase. But so again, I want to make sure to say the name of your book again, just so people know. And this is not sponsored by you. We met on social media and you let me know about your book. And I think it's fantastic. And this podcast, I choose to kind of, I certainly don't highlight everyone that approaches me with their products because I get contacted by a lot of really bogus stuff. But in your case, this is a fantastic resource. You're like, coming up next week, a supplement that's guaranteed to reverse your...
Oh, boy. Yeah.
But yeah, your book is called Invisible, a Nurse Turned Patient's Resource to Living Well with Autoimmune Disease. And I'll definitely put a link to it in the show notes. Yeah. And
yes, I appreciate that very much.
No problem. It is very grassroots, right? We have to just get the word out.
Definitely.
If people want to connect with you online, where should they go?
Yeah, so probably the easiest place would be either my Instagram, which is my first initial M for Melissa, and then my last name, Marquis. So Marquis 78, the numbers. So that's my handle. And feel free to friend me on that if you wish. And then my LinkedIn page. So you can just Google Melissa Marquis and I think you'll have a picture in your show notes for today. So you can match up the pictures, because I've got them all. I had some photo shoots done for the book cover. And so I've got all these great pictures now that I can rotate through. And so each podcast or different book event that I'm doing, I'm sharing different pictures. So you'll find them.
That's awesome. That's so great. Well, thank you so much. I know we went a little over than the usual amount of time, but I just really loved talking to you. And we did say beforehand that you were like, okay, we can go over a little bit, but thank you for anyone still listening to the episode.
Yes, thank you. I know it.
You get a gold star.
They haven't turned it off yet. Yeah.
Yeah. And hope everyone checks out your book or connects with you on Instagram, and we'll talk to you later. Thanks again.
Thanks, Cheryl.
Thanks.